Ano mai kato ay sine. Tomai kato mo. Wani pa kamalo.
Iyo. Siya puha ay tama whalea o kutuai nao. Okay, you see that green light?
Oh yeah.
Okay, it's gonna move. Just follow it. I think of it in our services as like a concierge, because when the patients are kind of lost through the system, or even if they don't even understand what things are, what they mean, what are they signing for, what type of appointments they're going to, we're there to kind of guide them. We do a lot of appointments where we advocate and actually escort a patient to a specialty appointment. It started with a huge grant that they received from HRSA, basically a health navigation program for and hiring and training facilitators that can go out into the community and within the clinic that are culturally, linguistically, just like the patients. Shelter
Okay.
Koi bini mantui koi bini koi yeah. So the beans koi protein they can mau mehe bean mantui. Our food is our culture, and our food is like all comfort food. So if they're like depressed or they're missing back home, they'll just turn to food. I always bring it back home. Just forget about your reality now. Just think about if you were back in the islands. What would you be eating? Everything would be fresh. I know we don't have access to that right now, but you do have access to things that are more fresher or that are more organic. Because they lived an organic life for so many years before organic even came out. Started the class 10 weeks ago, so that was August 30th. And we've been alternating cooking and gardening. It's mainly all of the diabetic patients. But our main focus is diabetic, Pacific Islander, Tongan, Samoan, Fiji.
Start to do it at home now, but it's good. It's hard to do that one because our food is different kind. We did like we cook a different way, but this is the way is best. This is the best way.
My parents actually got here in the late 60s, like 69. They have been helping people for over 30 years. They had an organization called Pacific Islander Outreach. They saw the violence in the street. They saw the drugs on our street. They cleaned it up. We had an after-school program at our house. We had a runaway house. My sister and I would sleep on the floor for those runaway kids to sleep on our bed. Like, those kinds of things. We would do it because we seen that our parents wanted them to have what we had. We didn't have even much. We didn't even have anything. They're saying, in our language, don't ever get tired of doing good for other people. I mean, that right there hit home because there are days like I just want to get out of here. But that quote that my parents keep telling us, I can never even leave this job. My parents are, they're really huge activists in this community. Because my parents, they don't just navigate like our family. They actually will take off their shirt for another person. With me, I'm like, I just get inspired by just knowing about their journey and their how much they've done. Because what I'm doing here, we're trying to do exactly what my parents did for me. And I always cry about this because my parents, they like really, 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 they really tried hard to never let us lose who we are. So I have a lot of a great foundation. And so when I come to work, I bring that with me. It's really important for me to show
that emotion to my patients, because once they see that, they know that I'm not just like some regular caseworker, or I'm like a government official just trying to get them to change their behavior of eating better or getting their diabetes better. They see that I'm a person. You know, I relate a lot of the things that I do with the patient to my own family.
This is Joyce Ho reporting for the Peninsula Press in the Stanford Graduate Program in Journalism.